Well, Smartpens are possible to download, so you could see both the amount of insulin units that has been given and the time for this dosing. And this enables healthcare professionals to better, shall we say, counsel the patients or individuals with diabetes regarding their diabetes management. Well, I think there are more tiers to this. I think it's possible to work with Smartpens not only with CGM systems, but also with specific apps, so that you could use carb counting, for instance. And with this technique and using multiple devices, the gap between MDI, injection therapy, will close and versus insulin pumps. So it will not be such a big gap in between these two different regimens. Well, we know from studies in type 1 diabetic patients that we will see a lowering in A1C. We will see an improvement in time in range. We will see lower and fewer hypos. And this will further down the line, it will have implications on both the frequency as well as the time to the first long-term diabetic complications. So it will have multiple implications. Well, that's a difficult question. Many countries, I presume that we will see that the Smartpens are first launched for type 2s with MDI. But I am sure that also patients on basal insulin only will also benefit, but to what extent, that remains to be seen and shown in clinical trials. Well, this is a new field, and unfortunately many apps have not been validated in clinical trials. So that's a drawback, and I would strongly encourage companies developing diabetes apps to participate in clinical trials and design clinical trials to show the benefit. But as I said before, I would say that apps that helps the patient decide both correction doses and meal or bolus doses are most likely to be beneficial in combination with Smartpens. Well, the current pandemic has been shall we say, a leveler with us, so that many clinical sites or clinical practices are using telemedicine in one way or the other to facilitate meetings, virtual meetings with patients, either via phone or via video or via digital platforms. And I think it vastly will be beneficial for the interaction when the patient and the doctor or diabetic nurse can view the same views regarding glucose data or insulin doses, both timing and amount of units that has been given, and combine these factors. So it is a new way of interacting with patients, and it's also very well received by patients and relatives if you have a pediatric population, because it saves time for the patients. Well, I think that of course we will see more face-to-face meetings, and we will be able to do more retinopathy scans and foot examinations and so on. Those measurements that have been performed to a lesser extent during the pandemic, but I foresee that we will indeed see still a large proportion of visits being performed virtually when this pandemic has waned off.